What's up, YouTube? Here in San Antonio, Texas tonight. Cold tonight. Not Colorado cold. Colorado not cold for Colorado, but cold for San Antonio, Texas for sure. Today I'm going to talk about scripts. I think there's a negative slant on scripts from the real estate side and the client side. And I think we need to change our perception on scripts. Scripts is not a tool for manipulation, period. I'm not going to talk about what to say, when to say. I'm just talking about literally the perception of scripts. And I just want to make sure that the agents have the right perception and also the clients have the right perception of scripts. I've been a flight nurse for over 10 years. I've been a regular nurse, and I say regular, a nurse for 13 years. As a flight nurse, we have what they call protocols or standard medical operating guidelines, called SMOGs for short. And those things are hundreds and hundreds of pages. Essentially what they do is they outline what to do in a situation that you may come in contact with. Here's the deal though. Do you think I could open that book up on the side of the road at 3 a.m. at a major vehicle accident? No, that stuff needs to be in my head. I need to be able to handle the situation that we come up to. And often, as a flight nurse, I don't even know what situation we're going into. Sometimes we get little bits and pieces. Sometimes we don't get hardly any information, just the location. And we don't know if it's medical or trauma, pediatric, obstetrics. It could be someone having a baby. It could be a neonate. It could be someone that just got born. It could be someone that's hurt. It could be someone that had a heart attack and they ran off the road and now they got a heart attack and they're hurt. The scenarios are literally endless. And right when I say I've seen it all as a flight nurse, something comes up that I was like, I could never imagine that in my wildest dreams. But with the experience and also the knowledge of how to handle these situations, that's what separates a great flight nurse from a not so great flight nurse, someone that just kind of gets the job done. I believe knowing your scripts is the same exact situation. Now, let me explain even more. When somebody comes up to me as a flight nurse, let's say it is bleeding out of their leg, me helping them stop the bleeding isn't really for me, right? It's really for the patient. And the goal ultimately is give the patient the best chance of survivability, the best chance to get to the hospital, the best chance to survive till they get to surgery, best chance to get them to the destination where they need to go. Clients in the real estate are really kind of the same thing. They're either buying or selling a house in some fashion, maybe through investments or maybe through renting or whatever. Our job as professional real estate agents is to know how to handle those situations. And what separates the great from the ones that just kind of get the job done, I believe, actually lie into not memorizing the scripts per se, but understanding the scripts, understanding what they're for. I think we forget as real estate agents that our everyday is typically someone else's maybe only day they've ever sold or bought. Certainly not, they are not in the same boat that we're in as agents. They certainly aren't seeing the volume of deals that we're seeing. And if they are, they're probably an agent or some kind of investor, and that's a different situation, right? I know as a flight nurse, my everyday is typically somebody else's worst day. And I try to handle my communication with them in that fashion. Very soothing, very explaining everything, talking to them, telling them that they've been in an accident or they're hurt and we're going to the hospital. You're in a helicopter. When you wake up, you're going to be in a hospital kind of thing. Like explaining to them, because there's so many unknowns for this patient in the back of the helicopter. I want to try to soothe them the best I can, to explain to them that I'm the professional, that I'm doing these things that I need to do. I know you might not totally understand this now, but I'm explaining to you the best I can, and here's what's going on. That's what scripts are in real estate. They are a toolbox of memorizing, internalizing, customizing, utilizing common things that we see on the real estate field. And it's the same exact thing as a flight nurse. with those hundreds and hundreds of pages, honestly, and this isn't a medical class, so I won't keep blabbing about the medical stuff, but truly there's only a few things that could actually go wrong. But the scenarios are endless of how those things could go wrong. So I'm not saying there's only a few things that could happen, because the scenarios are endless on what can happen. Again, when I said I've seen it all, something blows my mind when I land on a scene that I couldn't even imagine that something like that happening. But because of my knowledge of a flight nurse, because of my knowledge of what to do in these varying situations, I'm able to perform. Again, this is exactly, I believe, what scripts are for real estate agents. I think we need to change the way we look at them. I don't like the word objections. I don't like saying we're changing objection, we're counteracting their objections. I think we're soothing them. We're soothing them in the time to get them to their goal. Or their goal is to buy or sell a home. We're stopping the bleeding, and then from there may be other things. I have to stop the bleeding. Well, guess what? Now I have to replace the blood that he lost. And now I have to give him some pain medicine because he's hurting, because he's awake now, because he wasn't awake a second ago. So these scenarios go on and on and on, but they're built on the knowledge of how to progress towards what? The patient's best outcome. And real estate's the same way. Like, it really, truly is. Like, there's only one, maybe this one part needs to be fixed, but maybe that goes down the line that it makes more parts that need to be fixed. And that's okay. That's our job. That's why we need to understand the scripts and the common things that we may hear, common things that we may be asked, common things that people may, again, I don't like the word object, but that's just, you know what, comment down below on another word for objection, because maybe you heard something that I haven't heard. Comment down below and explain or talk about or comment on something you've heard besides objection. Because to me, it's like a concern, it's a question, it's an anxiety. And our job as professionals is to help in that situation to get the client, customer, person we're working with to their goal. So guys, please comment down below. Please thumbs up if you liked it. Thumbs down, tell me why. Why did you like it? Come on, you don't like this video? Don't thumbs down, give me a thumbs up. Comment, subscribe, like. And for more videos like this, and I appreciate it. Know your scripts for the clients. Know your scripts to get the client to where they need to go. It's not manipulation. It's knowing the industry. It's knowing the common things you may see on the field to help them get to where they need to go. The same thing as a flight nurse. It's understanding the common things that we may see on the field to get the patient to the ultimate goal of either survivability or back to the hospital. Excuse me. So guys, see you on the next video. Have a great night, and